Hello there, and thanks for watching NTV Uganda. I'm Romeo Busiku. Poor sanitation remains a major challenge in the world where 2 billion people still do not have access to basic sanitation facilities, and out of these, 673 million people still practice open defecation. You wouldn't believe. In Uganda here alone, diarrhea, yes, one of the 3 major childhood killers, kills 33 children every day. A 2012 World Bank report titled Economic Impact of Poor Sanitation in Africa showed that poor sanitation costs Uganda 389 billion shillings each year, or 1.1% of the country's GDP or gross domestic product. Open defecation alone, the report says, costs Uganda $41 million. That's about 100.4 billion Ugandan shillings, and eliminating it would necessitate construction of over 650,000 pit latrines in this country. 9 years later, after 2012, yes, after this report was authored, we would like to know how Ugandans are performing in terms of good sanitation practices and the impact of non-adherence on the spread of COVID-19. In honor of Sanitation Week, I'm now joined by Mr. Kabangi Moses, the Assistant Commissioner, Environmental Health Department at the Health Ministry, and Jen Sembuche, the Country Director for Water Aid Uganda, with whom I intend to expand more on this topic. Welcome to NTV Uganda.
Thank you.
Thank you.
Good to see you, Moses and Jane.
Thank you.
All right, it is Sanitation Week, and the theme for this week is good sanitation and hygiene. We would like to know more about that before we continue with this show right here. All right, let me start with you, Moses Kabanji. Sanitation Week.
Okay, thank you. Good evening, viewers. Moses Kabanji, and I work with the Ministry of Health as Assistant Commissioner, Environmental Health Department. We've been celebrating the Sanitation Week. We started on the 15th. That was a Monday. We shall be ending this on Sunday, the 19th. But today we had a commemoration to mark these activities. You asked the question about what actually the Sanitation Week entails. I want to say the Sanitation Week is an annual event, but at international level. It is an event that tries to emphasize the importance of sanitation, especially at rural communities where sanitation has been observed to be very poor. Like you said, you talked about the figures and then the number of people affected. The biggest percentage of this and the biggest burden is on the poor, and these ones are majorly in the rural settings. So the Sanitation Week is that activity that allows us, or that gives us that opportunity to highlight the importance of hygiene and sanitation in communities. And that's why we keep celebrating it. Yes.
Go ahead.
So we say it is an international event, and it was set up in 2004 in Dakar, Senegal, after realizing that investment and prioritization of sanitation among governments was actually very minimal. And of course, it was very clear, for example, from what you've mentioned, that poor sanitation was a big contributing factor to failing economies. So they thought it was very important to highlight and bring out the issue of sanitation very well, so that it could be on the agenda and could be adopted, especially by the policymakers. So that's why we have this Sanitation Week. It's celebrated internationally, but in Uganda it's normally celebrated from the 15th to the 19th. Okay, that date keeps shifting, but it's always the week that precedes the National Water Week Day. So they move hand in hand. After this week, we shall go into the
Water Week.
Yes, the Water Week. So they go hand in hand. So we know, but it's always between these dates, 15th, sometimes goes up to 18th, something like that. But it is an annual event. We celebrate annually. And
Jen Sembuche, why is it so significant to actually observe Sanitation Week?
The significance comes in terms of the importance that we put in managing our waste well. I think if we go back to the basics, like why do we need sanitation? I could pose the question of, once somebody has relieved themselves, once they have defecated, where does the waste go? Yeah, we know that this waste has pathogens. We know that we need to be able to take care of it and to manage it. Otherwise, as you said, 33 children each day in Uganda die because of diarrheal diseases, and a high proportion of that is because of poor sanitation, hygiene, and unsafe water. So when you look at those statistics, I was just trying to do quick mathematics here from the beginning of the year. If we're to count the way we're counting the numbers for COVID, how many children would that be that have died due to poor sanitation services? It's quite huge. And it doesn't stop there, because it has a lot of impact, not only health-wise, but health-wise in terms of diarrhea, but it is linked to malnutrition. It is linked, once you have diarrhea in children, then it leads, you know, chronic diarrhea, it will lead to malnutrition. But at the same time, when you look at other diseases besides diarrhea, we are now talking about COVID-19. There are studies that have shown there's a linkage in terms of how we manage our fecal matter to being able to limit and minimize. So the significance is huge in terms of the investments we need to put in place, the amount of money we take in treating and addressing something that we can prevent, rather than using money elsewhere. Yeah. So.
Yes. How does the threat come about when I use a toilet and then the other person comes through and then I infect them with COVID-19? Get me through the process. What happens?
Well, there are studies that are linked to it. You can, the reference to COVID, yes, but I would also like to reference the other diseases that are also creating such a big challenge, and that is why we're here. That's why we're celebrating it. When you use the toilet, maybe you're more privileged, you have a flush toilet, at least it goes down the drain. But the other people that use the toilet, either some are open defecating, they're about 10% of Ugandans are open defecating. Let's say you're using a pit, but once you have used and that waste is not properly managed, from the time you are collecting it or where you're defecating it to the time that it now comes into contact, what we're trying to do is to prevent the contact between when I've defecated, preventing the contact so that it doesn't go back into the human body. So that is what sanitation is about. So we need to safely manage it. And within the whole topic of sanitation, we have different ladders. And that is why, as a country may say, people have toilets, but what type of toilets are they? Yeah.
Are they pit latrines or these modern toilets?
Yes, even with the pit latrines, then you now go and say, okay, once it goes into the ground, is it contained? Because those are pathogens. If it is not lined in terms of preventing it from seeping into the ground, then there's also a high probability of infecting. We get cholera outbreaks in the rainy seasons. Why? It's because of overflowing fecal matter that go into water sources, or at times it's because somebody has drilled a shallow well or a borehole close to where fecal matter is being disposed, but it's not being contained. So that is that is how we need to be able to prevent it and manage it well, to the point whereby through the treatment process, eventually we're able to release it as safe waste, treated water.
Indeed, Jen Sembuche. I was reading a Chinese study, and they were saying that the biggest threat comes when you actually flush a toilet minus closing it. Yes, because if you don't close that toilet seat, and you flush, that fecal matter, the particles will just flush to the side, and the particles will remain in the atmosphere for over 1 minute. Meaning, if Romeo Busiku comes out, the next person that enters instantaneously will actually inhale the COVID-19 pathogens in the wake of me leaving the toilet. But then we would like to know, according to this 2012 World Bank report, government was supposed to erect 650,000 pit latrines. How far were we? Where do we stand as Uganda?
Now,
was that achieved? Yes.
That really, it hasn't been achieved. That's the truth about that. Of course, it was a good project, but there is something that is called demand. You did some economics, demand and then supply. Yeah, the communities may not be interested in those latrines. You bring a project and it's not their area of focus. So even if you took them there, you'll have issues of maintenance and operation. So we realized that it was actually something that was not going to work out well. But we thought maybe having these in the urban centers, probably somehow it would improve the level of sanitation. Yeah. So I think it is going to happen. the constructions and installations of public latrines and other public facilities in urban centers would happen, but certainly not in the rural settings. In the urban centers, we feel people really don't have access to these facilities. You know, urban settings have a lot of challenges. Small pieces of land, you know, there's nowhere to place a pit. So we think it's always better to provide one public structure where a number of them can use.
In the urban centers.
In the urban settings.
But we all know that opification is so rife in the rural areas.
Yeah.
In the rural areas than the urban centers. Don't you think you should be focusing on the rural side?
Now, like I told you at the start, the rural settings, the arrangement and the way of thinking differs a bit. In the rural areas, not because they have failed maybe to put these structures in place, but it's about behavior. Even if you put it in place and they don't feel the importance of it, they will continue practicing open defecation. You know, there are cultural issues, there are issues of utilization. For example, you're constructing a modern technology in a rural setting, and they do not know how to operate it. Yeah, these are schemes that had at one point were implemented. We had the eco-san systems being rolled out in communities, and communities failed to use them because they didn't want to see feces. So it is a bit tricky taking it to the rural area. But in the urban setting, you realize that people want to use them, but they have no option, and they don't have anywhere else to go. So they will go and use them.
Jen Sembuche, don't you think in the rural areas we should embark on maybe a sensitization drive before we get these pit latrines in those jurisdictions, because they need them? Simply stopping ourselves from going there because of their mindsets doesn't help the people in those areas.
No, we do go there, and the ministry does go there. So
to set up the latrines?
To be able to sensitize people on the importance of using a latrine. I think when you look at us achieving, being able to achieve you know, the results in terms of the coverage, we need to be able to look at you know, the different the contribution that people give themselves, their contributions and what they're able to put on the table. We're not going to be able to achieve universal coverage of sanitation through government doing constructions for households. So this is where Kabanji talked about in terms of behavior, the behavior and understanding the importance and prioritizing, you know, for these services. So rural areas do have projects that the ministry does. Organizations such as ourselves do that. However, I think we need to be able to really sell it and prioritize it.
Indeed.
I think I can ask the question, you know, like with these mobile phones, you're holding a mobile phone there. I wonder what type it is. I wonder what type of mobile. But everyone, you know, like when you go down right even to the rural areas, people have mobile phones, and everybody's always aspiring to get the next model, the next technology.
Sure.
And that is, I wish it could be similar with sanitation. You start, people with basics may be defecating outside, and then you improve, you have maybe some form of structure, but it's not really there. We need to have them to aspire to have a sanitation facility that they can even sit in there and read something or even eat. That is the aspiration we want to have. So it's about how do we make communities prioritize this as a need. How do we then sell it to them like any other product?
I see.
So that they themselves can crave the way people crave for the latest technology of phones.
Yes.
Mr. Kabanji Moses, go ahead.
To follow on that, actually, I like the way Jen brought it. When you just bring a technology, it's new to the community, and you just bring it on, people will tend to shun it. I want to give you an example. Some rural facilities, Ministry of Health we had a program. We installed flush toilets, and in the rural communities. So what happened is that we discovered people, mothers, and were finding difficulty because for them, they were mounting the pan. You know, like somebody sits on, instead of sitting on it, he's just mounting it, and then it was funny. Then at some point we had issues of utilization, usage, they were breaking.
Blockages.
Blockages. Then we said, no, I think we need to introduce this technology gradually. You can't just bring this to the society. So we must begin we are now moving out from the traditional type of latrines, like he says, but we can't just jump. There are other levels in between. Yeah, so I think we can introduce these technologies slowly by slowly.
Of course, the theme for this sanitation week is good sanitation and hygiene, a sure way to fight COVID-19. Help us understand the correlation between COVID-19 and poor sanitation practices.
There is a very strong relationship. Actually, we did this to emphasize that right now, the key intervention area is in COVID control and prevention is WASH, although we have a vaccine. But the real issue is that good sanitation is very key in fighting almost 75 of the diseases. Be it the Ebola you've heard of. Once people wash hands, once people stay clean, then it is likely to be very minimal. Most diseases are really... now, so when you wash hands, there's research that when you wash hands, you reduce the viral load. And therefore it means you will not take in any of those organisms, or you will not even pass them over to another person.
All right.
Yeah.
If you're watching this show online, the hashtag is SAH against COVID. You can also follow this conversation on Twitter, Facebook also, and we're also live on YouTube, SAH against COVID. That is the hashtag for this conversation. I have Jen Sembuche, the Country Director, Water Aid Uganda, and also the Assistant Commissioner, Environmental Health Department at the Health Ministry, that is Mr. Moses Kabanji. All right, Jen Sembuche, let's talk about the correlation between COVID-19 and poor sanitation practices, in your opinion.
COVID-19 and poor sanitation practices, I think it's all linked to hygiene. Yeah, we started off well in terms of, you know, like last year when it broke out, hand hygiene. There was quite a lot of engagement from communities. You know, like everybody wanted to practice. Everywhere you'd go, you'd find there is a hand washing facility there. Now, if we're able to the same practices take it into sanitation, because using a sanitation facility also needs some etiquettes and behavior aspects. If we're able to bring that into play, then we can be able to address, you know, like the potentiality of exposure to COVID through the fecal matter. But as you go into sanitation facilities, your hygiene practice, hygiene is not just about hand washing. It's about keeping yourself well and unite by different practices. There's hand hygiene, there's food hygiene, there's even how you use toilet facilities. So we need to be able to inspire and create the behavior change that can enable us to prevent what we already know could potentially lead to exposure to the COVID.
Is it only because of behavioral change or people being unable to afford the services they need to adhere to the SOPs? Yeah,
indeed. It's the big part is about behavior change. But at the same time, in terms of facilities, because I'll take examples of public facilities. When you go into hospitals or maybe schools or even within markets, how are people using those? Yeah, you go into those and you find that you have a good facility, but the way people are using it are making it inaccessible because the next person won't want to be able to use it. So definitely you take out the hygiene, there's an aspect of infrastructure. And in terms of infrastructure, you can have the building and the toilet facility, but if you don't have water, and particularly because of the work we do with public facilities, water bills can become high, and then you find it's difficult for those facilities to maintain. So there's an aspect of how can we be able to accommodate these high costs, because we know it's going to a bigger cause. So the government here also needs to come in and step in and see how can it relieve such costs so that we can facilitate. And it's all in the process of facilitating people in being able to practice. Because I cannot practice in as much as I may know I need to practice, but I can't do it when the facilities are not there. Those are public institutions. But at the household level, you know, like that aspiration, that longing for households, the way they long to have the best phone, we also need to create that. I don't think as a country we'll be able to construct toilets for households, but we can inspire them to be able to see how they can use innovative way and technologies that are cost effective for them to be able to do that. And once they've done that, then it facilitates the whole process.
All right, do you buy into the whole idea, Kabanji Moses? Because most of the health of ministry officials I've talked to, they say there is no correlation between adaptation to these wash services and poverty. They say it's not an issue of money. As long as you give people the information they need, please buy soap, get water, they'll get those services. But as she contends in her submission, it's very hard for some people because poverty is biting hard. They may not have money to buy soap and water. Don't you think this is a point where government has to pitch in? 2 billion people, no access to adequate water all over the world. What are the numbers in Uganda, and what are you doing to help people actually adapt?
I want to agree with Jane. Yes, this is true. In some cases, the economics come into play.
Indeed.
Yeah, issues of money, especially when you're in urban centers. You are talking of people buying land, probably they have small pieces of
Especially in
land.
urban centers, not rural centers.
But in the rural centers,
Right.
the issue of poverty doesn't really, it's always a secondary issue. Once you give people information and they agree to it, and there's some bit of change, they always...
In Kasese, say Kavanji, they are using ash as a disinfectant. That is how bad it is. That is how bad poverty has spread among members of the community.
Of course,
Kasese, they're using ash, but they know you need water and soap. But
Yes.
simply because they don't have those services, ash is the alternative.
But you see, Busiku now,
And it's not effective.
it is going to be very, it's not very sustainable for government to provide, say, buy soap for the citizens continuously. It is a bit tricky.
But they can avail water sources for the people.
Which the government is doing. Right now, I think our water coverage has risen. I think we are somewhere closer to 75%.
Yeah.
One of the highest in the regions. And it's quite good. But the problem there is the issue of operation and maintenance. You provide a facility, but the communities are not able to maintain. Once it breaks down, for example, a borehole, replacement becomes an issue, even if it is just a handle. And over time, they lose that facility. Yeah, but the issue of poverty, the correlation is not very strong. People have demonstrated where we go and do really campaigns and sensitize. People have been able to put up very nice structures and have been able to use them. That is different from you providing a structure like she said. You place it, for example, in a market, and people just misuse it, and others can't access it because it's too dirty and can't be used. Yeah, so I think it's the issue of behavior. We need to invest a lot in behavior. And culture here, our culture, has a very big role to play. You are dealing with communities that are diverse in culture. Some of them don't even believe in using latrines or using these sanitary facilities. They still believe in open defecation. So I think it's not about yes, money comes in. That's where we are engaging government and telling them, look, please, can we do something? For example, can we provide simple, cheap loan systems to support sanitation? Can we, for example, reduce taxes on sanitary products? And probably, can we, things like that, reduce the burden and to ensure that people are able to access these products at a much affordable. But the key issue here, like Jane has observed, if you go to institutional facilities, the biggest problem is about the costs involved. That one I agree with you, ultimately. Because running a facility that is using tap water is not very, very, very easy. It's very costly. And sometimes our own facilities have run out of water and you can't find water. And you can't run those toilet systems.
Indeed.
Yes.
Moses Kabanji is the Assistant Commissioner, Environmental Health Department at the Health Ministry. He's not alone. We also do have Jen Sembuche. She is the Country Director, Water Aid Uganda, and this conversation is running under the theme, Good Sanitation and Hygiene, a sure way to fight COVID-19. And of course, we do know COVID-19 is not the only threat. There's hepatitis A, there's hepatitis E, and a little bit of hepatitis B also involved. Cholera, dysentery, all these diseases that might accrue if you do not watch your sanitation practices. Well, let's take a breather. We'll be right back with more of this conversation, now interrogating the correlation between climate change and poor sanitation practices or waterborne diseases. We'll be right back. Welcome back to NTV Uganda. We are still interrogating this sanitation week and crowning it this Friday with a conversation on how best you can actually adhere to good sanitation practices to avoid catching COVID-19. It's not only the only disease. We also have hepatitis A, hepatitis B, hepatitis E. You can get infected. Yes, cholera, dysentery, and all other diseases. Now, I would like to interrogate the correlations between climate change and, yes, waterborne diseases that might accrue from bad sanitation practices. Let me start with you, Moses Kabanji. The correlation between climate change.
Yeah, but there is a strong relationship between climate change and sanitation. You realize that during periods of advanced climate, for example, strong rains, there is a tendency for infrastructure, breakdown of infrastructure, breakdown of sanitary facilities, and therefore it means that you deny access, you reduce access to these sanitary facilities. But also, the breakdown means that, especially where you're using pit latrines, means that there is a probable washing away of fecal matter and into runoff. And these are normally washed into nearby water sources. So it means you are likely to see an increase in prevalence of the diarrheal diseases, and those ones you've listed. So they are directly correlated. And we have to appreciate that in the rural settings, there are geological issues. People construct latrines on probably sandy areas, the places are sandy. So when it rains, they collapse, and there's a lot of seepage of fecal matter into the soil, and normally it ends up in water sources. So there is a strong correlation. Of course, you have, when you're in urban centers, you've had where there's highly populated places. What happens when it rains and people do empty these latrines into the runoff, and this one is taken into the nearby water sources? Waste, a lot of waste generated. If you look at drainage channels around town,
I've seen people unload rubbish when it rains.
Yes. So they unload and it is washed away by this water, and it ends up in the nearest water collection points. And some of these are areas that we use for drawing water that we use for consumption.
But I haven't seen any sensitization campaigns on the part of the health ministry to actually tell people it's actually bad to pour rubbish in moving water. It has to stop somewhere.
There is a lot of sensitization. Ministry of Water, I'm sorry I can't speak for them, but they have a whole program that is designed to ensure. Actually, there was a problem with Lake Victoria. A lot of pollution from waste. And so there's a whole program.
Fish was dying. Yes.
Yeah, fish was dying. And so there is a program that is sensitizing communities around Kampala to ensure that they do not allow this waste to be just put anywhere. And so they know that it ends up in the lake. So they don't want, they have been sensitizing people to stop that. KCCA has a similar program, very powerful and strong program about waste management. Because we all know that once you don't do that, in urban settings, people will just put waste anywhere. So the challenge is the new places, the new cities that have been created. We have not had strong and bigger programs to address that.
All right.
But when you're talking about Kampala, then a bit of Wakiso, there is a very strong program under Ministry of Water, and then also KCCA, plus other players. WaterAid is doing something, I think, in relation to there's also another player around waste management and the rest. So they are Jane
Sembuche, kindly make an addition on that.
Yeah, I think I want to also complement where Kabanji has spoken about, and the ministry and the different municipalities and cities have bylaws and regulations. And there are a number of them that are linked in terms of waste management, sanitation. So I believe they have very unique people on the ground. You can't just release things the way you want. You'll be taken up and charged. So I believe that is in process, but there's still a lot that needs to be done. I also wanted to be able to add climate change and sanitation. There's a lot of adaptation we need to do. Yeah, he's talked about sanitation facilities breaking down or collapsing. So even with the challenge of climate change, there's also the challenge of looking at what technologies are we using to ensure that as we invest, we're not investing for just 2 years, but we're already taking into account the possible damages that could could be the result of maybe flooding or heavy rains that can safeguard the investment that we're doing. So there's some work we're doing, and we're doing it with the Ministry of Water. We've just started something up in Mbale and Tororo area in trying to see how can we look at some of the adaptation mechanisms in regards to WASH, and that is water, sanitation and hygiene. We're looking at sanitation now, but there's a lot of eroding or breakages of infrastructure when we have severe droughts or heavy rains. That takes us back. So with the challenge of climate change, it also challenges us as well. With the steps we've already gained, in terms of the gains we've done, it takes us back. So it means that we also need to be planning in our work for climate adaptation. Of course,
it takes us back, because I was looking at a report and it was actually saying by 1989, 1990, poverty levels all over the world were at 30%. Fast forward to 2015, it reduced to 10%. But you wouldn't believe in 2021, the projections are that more people will slip into poverty up to 13%. Meaning we are going back 6 years back. And more. That's how tough the situation is. And you said very, very well, we should talk about adaptation to climate change and sanitation facilities, and sanitation as it is. But then you were also telling me when we went for a break that some health facilities are also grappling with inadequate sanitation of facilities.
Yes.
Go ahead, expound on that.
Okay, indeed. A few years ago, there was a global call for WASH in healthcare facilities because of the challenges that we've also seen within facilities. And Water Age Uganda in 2019-2020, we did a study here in Kampala with the Ministry of Health, Makerere University, MRI, and a few other players, and we discovered that when you look at sanitation facilities, they're about 82% of the healthcare facilities have limited access to sanitation facilities. And what do we mean by this? You find that in some cases, you may have a sanitation facility, but it's not accessible. It's there, but it's not accessible in the sense that it's either filled up, it is not decent in terms of protecting somebody's privacy, there are no doors, or there are no, it's dilapidated. So there's a big gap that we found. And it's also linked to a study that UNICEF did as well with similar percentages. And I'm just talking about the sanitation side. I think sanitation, out of the three elements, was one of that had the biggest gaps, followed by the water. Now, when we look at this, and indeed healthcare facilities are where we need to, we're providing health services. But we also realize we need to also invest more in it, particularly with WASH. And that is why globally there was a global call that was in 2019 as nations to be able to focus resources into this area. Indeed. And I think for me today, I would really want to see how can we be able to tackle that. Indeed.
Moses Kabanji is here. He'll help us, interrogate that. Moses Kabanji, the World Health Organization and also UNICEF in 2019 told us 88% of healthcare facilities in Uganda don't have usable sanitation facilities. What is happening?
I think
88%.
88%. We have standard indicators. We have standard indicators. They apply both to sanitation in rural communities, but also in institutions. So when you have a sanitary facility and doesn't qualify in certain terms, then we actually calculate, and we actually believe that one is not available. One, for example, you're talking about a maternity ward where a mother is going to deliver, and you've provided a conventional latrine, a pit latrine. That one is not going to be used. I mean, you don't expect a pregnant mother to go in a pit latrine. They are worried that anything can happen. So that one is not going to be accessible. But also, we are talking about a latrine where you're not considering issues of gender. And so probably you'll have one sex not actually wishing to use some of those facilities. Then the issue of maintenance, Jane mentioned that. They are so dirty, they are so dilapidated, that somebody feels he would better wait.
So what's the health ministry doing in that regard to rectify this situation?
Well, we have a program that has been running around, a program of refurbishment of facilities.
All right.
And putting in place in modern structures is part of that program. But also, we are working with our donors. We're working with our implementing partners to ensure that we put proper facilities. I think 2 days back or 3 days back, we had a meeting, a stakeholder meeting on WASH, and we're discussing current designs, appropriate designs for healthcare facilities, and we are going to roll those out. And we have shared these designs with the Ministry of Health, Infrastructure Department, and I think we are going to share that with the Ministry of Water to ensure that where we are going to put a new facility, it conforms to the international standards, not the traditional type of facilities we've been having. So we are doing something, but we are also going to invest there, but also our partners are also going to do something. UNICEF is going to assist in the construction of many of these facilities in their area of operation, but also Water Aid has that component, especially around Kampala.
Yeah. Jensen Bucheria is saying in 2019, 88% of our healthcare facilities did not have usable sanitation facilities. Fast forward, in 2020, we had a lockdown in March, on the 20th of March. So would you say that that situation actually became worse as we went into the lockdown, you're moving over to 2021? And do you think that could have been the reason why we saw an uptick of COVID-19 cases in this country? Poor sanitation facilities or unusable sanitation facilities?
2019 to where we are now, I think we cannot attribute in terms of whether there's an increase or decrease. I think the time frame doesn't allow for that. I feel with COVID, there's been quite more focus in terms of interventions. I think the government and different players have really come out to be able to support healthcare facilities. So I'm expecting to see probably
a reduction.
An increase in terms of facilities being put in place. I want to also build on what Kabanji has talked about in terms of like some of the things that we need to be able to do. And I think one of them that is being led by UNICEF is development of WASH in healthcare guidelines. We do not have them as a country. It is important and critical that we have those, because then that is what helps in terms of planning and even in advocating for more resources in these areas. So we are thankful that UNICEF has taken lead, and as different players were coming on board to be able to support that process.
And of course, our students are back in school, and we do know many of them grapple with sanitation facilities. How rife is this magnitude in these schools?
Within schools, indeed, schools, the challenges are there, and if you look in terms of the ratios of drop holes, like we say, one drop hole, like what that one stands per pupil, as a country, it is high. You may have one drop hole catering to Dr. 100, 200.
1 to 45.
Yes.
Yes, that is the standard. But the reality
220
is
actually in some places 400.
Yeah,
that's amazing. Go ahead, Jay.
Yeah, so that is the reality. So there as well, there are challenges, and of course, as Water Aid and other players, we come in to be able to support a bit. For us, it's a drop. Because if we do, let's say in a district, 2 or 3 facilities, that's just touching the surface of the challenge. And the bigger challenge is, is looking at how do we now get the different structures, within the system, within the government system, to be able to deliver this. And for me, my aspiration, I think, as as a development person, having worked in this field, when you talk about such issues and how can we progress, then it comes down, I think, principally when you look at the leadership and the governance, it starts there. And it starts at the districts in terms of how do they plan for this? How do they input it into their planning? How have they prioritized it? But as they plan, of course, those, government has to release funds. But okay, how has it been prioritized? How have the different levels, in terms of the capacity building, been looked at so that they facilitate the process? So there's a whole systemic aspect and focus that we need to be able to take into play for us to be able to achieve. Otherwise, year in, year out, we'll be sitting here talking about the same things, and we're not progressing. But then the challenge I want to put towards, as leaders in our own levels, how are we taking responsibility to achieve these milestones?
Indeed. Amazing insight from Jen Sembuche. I also do have Moses Kabanji. Moses, let's talk about continuity. How do we leverage Sanitation Week this year to reinforce hand washing habits so that people, you know, are there, not just on Sanitation Day, but every day, every single day?
Yeah, actually, somebody asked me this question during the commemoration.
Yes.
But now the 1 week is over, so should we forget about sanitation? It was funny. But the sanitation week is just, we are just sending a message. We use this as a forum to advocate, especially to the leaders, then to create awareness for the leaders to understand our plight in the area of sanitation. But we are doing a lot. We have the government, and then we have partners who are down in the field, and we are busy engaging the communities. But I think we are trying to look at a new approach, where this time we shall be involving the village health teams, strengthening them, building their capacity, so that they can continuously engage the communities, even when we pull out out of any place. So we think that one will be able to improve. But also, we want to have the issue of sanitation. There's what we call, is it mild sector? We want to have it cross-cutting. That if you're planning for your agricultural interventions, please do plan for, include some element of sanitation. Because if you have mothers sleeping with goats in the houses because you're providing goats and chicken, and they are sharing houses with these animals, then you're creating a problem instead. So we want to integrate that. If you're talking about gender issues, please, sanitation is a key issue in gender.
Is it possible to also acquire bloodborne diseases through poor sanitations, like Ebola?
Sure.
Go ahead.
Sure, because you know that Ebola, mainly, they are spread through contact with secretions, and although they are airborne, but sometimes when you touch surfaces that are uncleaned, then you are exposed. So we have what we call environmental sanitation and cleaning. We emphasize this in care facilities, that when you have a COVID patient, please ensure that the surfaces and the areas, including linen, are well cleaned, so that you do not have organisms being carried from one area to another.
Jan Sembuche, let me get the perspective of Water Aid Uganda on how best we can leverage Sanitation Week so that it's not just a day. People can adhere to, you know, hand washing on a daily basis.
Okay, I want to build on the same point you've asked me, to what Kabanji has talked about. He mentioned, you know, like government and donors in terms of taking it forward. But I think what we should always remember, and where the power lies, are within the communities, are within the people, you know, the people themselves.
True.
I've always been told at some point in my life when I was growing up, still, you know, like studying and stuff, you know, like you would ask why the government is not doing this. I'll be told, okay, you're saying the government, but who's the government? The government is me. You know, like I'm part of the government. So as an individual, what am I doing? So I think for me, in terms of leveraging, will be, yes, the government has set us the foundation. The ministries have done the foundations in terms of what we need to be able to do. Yes, we do have players such as different donors coming in and supporting, such as Water Aid. But what are we as individuals, as community members doing to be able to take forward the agenda? Do we buy into it? Are we committed into it? As a country, do we want for us to realize an open defecation-free Uganda? Are we aspiring for that? I think we should aspire for that, because it has different aspects of how I'm seen as an individual, my dignity. I don't want to be seen squatting somewhere, relieving myself. So I think the people need to be able to aspire for that.
And they should also know that the country loses almost 104 billion shillings when they go and defecate in the open.
Exactly, exactly. So I think that's where I would want to leverage. I would want the nation as individuals to be able to know that it's not, I'm not just waiting to look at the government or donors, but what is it that I can do in my own space? Yeah? I have the power, I need to be able to work on it. The little that I can do at a household, I can aspire to create something better in terms of a toilet so that my children can access.
I hear you, Jane.
Yeah.
But let's talk about what government can do before we wrap up this conversation. What can government do differently to sustain the new hand washing, to sustain the hand washing behavior that was adopted due to COVID-19?
I think there are different levels. The first for me always is on governance and leadership. I think the second area will be looking at ensuring that at different levels you have the capacities to be able to ensure what has already been gained we do not lose. We need to be able to bring collaborations from different players. I think if you're talking about...
Leaders have to step up.
Yes, leaders have to step up. That is in the first, governance and leadership. We also need to be looking beyond in terms of these, the practices we want to see may also have financial implications. How are we bringing in other partners? How are we looking at the public financing? How are we looking at private sector? And then how do we use innovative ways to be able to address the challenges or where the gaps are? So I think for me, those would be some of the areas I would really be looking at, because it's not a single answer, but it's a multitude.
How about, Jen Sembuche, how about local leaders getting involved in the whole process at the lower level, going around assessing the magnitude of the spread of the diseases as a result of poor sanitation, assessing the sanitation in the markets and so forth within their areas? Do you think local leaders, like the LC1 chairpersons and so forth, should get involved?
Most definitely. And linked to the same, for Wateride, we have a project here in Kampala called the Suswash Project. And we engaged the mayors within Kampala. And it was really amazing. Mayors are speaking out in terms of wash as professionals. They are going out and inspecting different property owners and addressing the issues. They came out with an ordinance, a sanitation ordinance, I think it was in 2019, 2020. So that is the power of leadership. So most definitely we need to be able to get those leaders on board, and that is where gains will be done. Once the leader understands, is able to do it, then they do it. And we do have leaders that do that. We probably need to call more of them to be able to address these issues.
Mr. Kabanji Moses.
Actually, what happens is, where there is good leadership, we've discovered that the sanitation indicators always up there.
But if you go to places like Nansa and Uganda, you would be surprised. It's like the leaders are sleeping. Go ahead, Moses Kabanji.
So what can we do? You said what can government do? I think for us at a high level, Jen has simplified it, but at high level, I think we need to prioritize sanitation, wash generally, through financing. We need to have increased investment in wash. But we also need to follow up on our commitments. We have commitments we've made. For example, the DACA one, there are commitments we made. There are a lot of commitments we made internationally. And so we need to follow up on these commitments, especially if we are aiming at looking at our SDG. As
the
6.
Assistant Commissioner, Environmental Health Department, I really do urge you, Moses Kabanji, to go to Nansa and Uganda, one of the areas, and please just do an assessment drive. You'll see real carnage. Boys say here, real carnage. You'll see how bad people are living, and the conditions are really dire, I'm telling you. So what can government do differently to ensure that all Ugandans as a whole, besides Sanitation Week, they adopt hand washing with soap voluntarily?
Well, I already mentioned that. I said, one, we need to invest in a number of interventions. But there is something we normally keep forgetting. We have what we call, I think, this physical planning. Today I was privileged to meet a gentleman from Ministry of Lands and
fixing drainage channels and so forth. You have Camwatch at 10 years. They were promised that drainage channels would be fixed between 2006 and 2011, that time. But up to now, drainage channels, they have not been fixed.
So there is a problem between planning and actual physical plans that we have. There is no control over planning. That constructions are happening haphazardly. People are not bothered whether you're constructing on a drainage line, whether you're so we need to engage the planning authority, Ministry of Planning, whichever, to ensure that at least we adhere to the required standards. Somebody buys a small plot, very small, and he wants to put everything there. And then the other aspect is we can improve this. When I was a small boy in primary, there used to be some subject on basic science, and sanitation was very well detailed there. And if you went to school with some of these aspects, maybe untrimmed hair, dirty shoes, you really would be punished. Now, we need to inculcate this into our children as they grow, because sometimes it's very hard to bend these old people. But we can begin this from down. And we can have a lot of change when we begin with the young people. And I think we talked about funding. There are societies that are doing poorly. We need to look at the way we allocate our allocation formulas. Where are we allocating our resources? There are places that really are doing very fine, and you're giving them the same allocation with a place that is very struggling.
And of course, we've been losing 389 billion Uganda shillings since 2012. Do you think it has gotten worse, or you've made some reductions?
I think over the years it has been getting worse. But I think in the recent times, towards the outbreak of COVID, our studies and assessments indicated that there was a very slight improvement. But that slight improvement is insignificant, because you have about up to around 12% of citizens in Uganda living in open defecation free areas. It means the other 75 or 85% are actually living in areas that practice open defecation, which is very, very dangerous.
So meaning right now 80% of Ugandans are still practicing open defecation?
Oh, sure.
Wow.
So you have communities that are actually practicing open defecation. Less than 12% of the communities.
I'm glad that you're being honest. Jen Sembuche, please give us your parting shots with the last 2 minutes and we wrap up. What people ought to be doing to ensure great sanitation practices before we leave.
Yeah, I think in terms of, as we celebrate Sanitation Week, I really want to be able to implore, I think, the communities and individuals, you know, like, it all starts with me. You know, like, it starts with me as an individual. What am I able to do in my own space, within my own setting, to be able to address the challenge around sanitation? Once we started that from, you know, like, we start with the individual in the household, then we're able to achieve. I think the guidelines, in terms of guidelines, we have, but then you look at what can the government continue doing in terms of creating that awareness, creating, you know, like, the behavior change programs to enable people to become aware and to understand why they need to be able to prioritize.
Indeed.
So that would be the second aspect. My third aspect would be looking at, indeed, we are behind on a number of aspects. We need financing at a different level to the households. How can we, as Ugandans, through our governments, be able to increase the allocation? And I think we've seen, in terms of the importance of addressing the sanitation gaps, how can this now be put, you know, like, in terms of
All right.
financially? Yeah, we shouldn't come here next year, speak about the same things. This is where, you know, like, partners here such as
Moses Kabanji.
Yes, is able to support us, but also we have different leaders at different levels. Yeah, if we don't do anything, then things will change. So right up to the top. And I would also, you know, like, be bold and take this moment to even ask our President, His Excellence, how can this really become a national agenda?
How can we stop the 80% from defecating out in the open? Jen Sembuche, thank you very much for that submission. Moses Kabanji, yes, final words from the government.
I think what we are trying to do, we are trying to engage our colleagues, engage different ministries. Today, during the commemoration, I made an effort to invite almost all ministries, but I also gave them a responsibility to give us a relationship between sanitation and their indicators, the performance indicators. And it came out very clearly. Amazingly, people were able to appreciate that there is a very strong linkage. So we are engaging different stakeholders, engaging different ministries and agencies to ensure that we handle the issue of sanitation together. But also, we think we are going to want to work hard and ensure that we facilitate the private sector to ensure that probably there's a lot of engagement, but also improve their participation into issues related to sanitation.
All right.
Yeah.
Moses,
before you close it, there is we engaged Unilever at one point, and you could do, the results were very good. They gave soap to a certain group of people somewhere, and they were trying to look at a number of issues, comparing, and their results were amazing.
Indeed.
So I think that's what we are trying to do.
Moses Kabanji, the Assistant Commissioner, Environmental Health Department at the Health Ministry. He is not alone. We also did have Jen Sembuche. She is the Country Director, Water Aid Uganda. And the theme for this conversation was good sanitation and hygiene issue a way to fight COVID-19. But it's not the only disease. You have Ebola that could accrue from poor sanitation. You have hepatitis A, hepatitis B, hepatitis E, and all these other diseases. My name is Romy Busiku. Have yourselves a blessed day and wash using soap.